Hi, my name is Priscila and I'm from Brazil. The name of my poster is The Perception of the Knowledge of Dentistry Undergraduates about Orofacial Harmonization. So, the introduction. The relationship between oral and facial aesthetics is notorious in society, and the search for aesthetic precision calls for the specialty of orofacial harmonization. So, the object of this work is to evaluate the knowledge of a student of the Faculty of Dentistry, Federal University of Rio de Janeiro, about procedure in the legal aspect of the specialties because of the growing number of dentists who wish to work in these areas. Methods and material. An evaluation was carried out using an electronic questionnaire on the Google Form platform, addressing in general and the specific aspect of orofacial harmonization. The students are invited to participate on a complete voluntary basis in the period of 2 months, from March to April 2023. Totally 159 answers. So the collected data are tabulated in Google Form itself, where we made a descriptive and statistical analysis or perform. So the result. The chart 1 is a question in the questionnaire answered by the student. The most important question is the number 5 and number 6. When we ask the student, number 5, is bichectomy is allowed for dentistry for aesthetic reason? And number 6, is rhinoplasty allowed for dental class? So the graphic 1 is a number of the students who respond to the form separated by period. So you can see the most grouped student is the period 4 and 5. The chart 2 is a result of the answer of the student who answered from the first to third period. That group when begin the university, so they start the university and they have some doubt about bichectomy is for aesthetic reason. So some students say no and I don't know. But that procedure isn't allowed to us for to do. But the rhinoplasty procedure, the number 6, the student begin the university and they know that isn't allowed to us for to do. But the chart 3 is a result of the answer of the student who answered from 4 to 6 period. That group, the student, and is when the student begin to appointment some patient in university, and we still have a doubt about bichectomy. It's for aesthetic reason. For us to do. But the rhinoplasty procedure, some students answer yes, but that procedure, number 6, the question 6, isn't allowed to us for to do. But the chart 4 is a result of the answer of the student who answered from 7 to 8 period. That groups in university is when the student go to finish the university and still have a doubt the bichectomy procedure and still have a doubt sobre rhinoplasty procedure, and some students answer yes, but that procedure isn't allowed to us for to do, but bichectomy procedure is allowed to us for aesthetic reason. But the craft 2 is a search of information through which the student can add knowledge about orofacial harmonization. That question, the student can choose 2 options, and the number 1 choice for the student is the social media. So I conclude, according to the result above and analyzing, the number 1 as for the student in knowledge about the procedure integral in the health, there is a lack of certainty in relation to the find of active and specialty. And number 2, we identified to the need to include health teaching in the graduate curriculum. Number 3, the mean lack of knowledge of the student participation has relating to rhinoplasty procedure. Number 4, the main means of information for students is still social media, which makes it essential for the university to occupy this space, avoiding the dissemination of wrong and misleading information on the subject. And that's it. Thank you so much.